With all the conversation around Lindsay Clancy's trial and the different factors coming up in testimony, I want to talk about something we look at clinically that I think gets lost when people are talking about risk, and that's protective factors. I'm speaking about this as someone with a master's in marriage and family therapy with a trauma specialization, and I'm not making a clinical assessment of Lindsay from courtroom testimony. I'm talking about the clinical concept itself. When we're assessing risk, we're not only asking what increases this person's vulnerability, we're also asking what factors are helping buffer that vulnerability, support functioning, and keep this person connected to safety. Protective factors can exist at multiple levels. Individually, that can include things like problem-solving skills, emotional regulation, adaptive coping, hope, purpose, and the ability to seek help. Relationally, we're looking at things like supportive relationships, connectedness, and having people who can recognize changes in your functioning and help you access care. Then there's the broader system: access to effective mental health treatment, continuity of care, community connection, cultural or spiritual resources, and whether someone actually has access to the supports we're expecting them to use. And this is where I think people sometimes misunderstand protective factors. Having a supportive spouse doesn't mean that someone can't become severely mentally ill. Having children doesn't automatically protect someone from a psychiatric crisis. Being in treatment doesn't mean that someone can't deteriorate. Having protective factors doesn't mean that someone is safe. In fact, clinical risk assessment treats protective factors as one part of a much larger picture that includes current symptoms, suicidal thoughts or behavior, intent, access to lethal means, history, recent changes, precipitating stressors, and the person's current level of functioning. And I think the trauma-informed piece matters here too. We're not just asking what's wrong with this person, we're asking what happened, what vulnerabilities are present, what's changed, what resources are available, what relationships are helping, what's deteriorating, and what can we strengthen. That's a much more complete way of conceptualizing risk, because resilience isn't simply an individual trait where someone either has it or doesn't. People are embedded in relationships and systems, and those systems can either increase vulnerability or provide meaningful protection. So when you're hearing people talk about risk factors in a case like this, remember that a responsible clinical assessment isn't a checklist where one factor determines the outcome. We look at the whole picture: risk, protective factors, warning signs, context, change over time, and the interaction between the person and the systems around them.